Hey everyone, welcome back to my channel. My name is Jamie, and today I'm going to be talking about an experience that I had recently with medical providers who were really queer and trans-affirming. So I am non-binary, which means that I identify as neither a man nor a woman. However, as with many trans people, I occasionally need medical care for parts of my body that are traditionally associated with my sex assigned at birth. And while gynecological care can be a stressful experience for many people, for non binary people and for trans men, it carries the additional risk of constant misgendering, along with interaction with body parts that might cause dysphoria or discomfort. To make matters worse, I was going to the gynecologist for an IUD insertion, a procedure that I have gone through in the past and that I found to be extremely painful. As a quick aside, IUDs are intrauterine devices. They are long-acting reversible contraceptive methods that are inserted into the uterus, and they act to prevent pregnancy. Certain IUDs, those that release hormones, can also lighten or stop the menstrual cycle, and that was the primary reason why I was getting this IUD. So since this experience was probably one of the best I've had as far as affirming medical and specifically gynecological care, I want to go through and highlight all the things this provider did to make me feel comfortable, both in terms of respecting my identity and generally making the experience less nerve-wracking and less painful. So the first thing was that the provider did not misgender me at all. As soon as I scheduled my appointment, I sent an email to the provider and let them know that I am non-binary and that I use they/them pronouns. From then on, not a single person that I interacted with at the clinic misgendered me. That includes the nurse that performed the required contraceptive counseling session, the receptionist at the clinic, the technician who took my vitals, and the gynecologist who actually performed the procedure. Not once was I referred to as ma'am or miss, called a woman, or had the incorrect pronouns used to address me. The only thing that even comes close is the fact that the clinic was located in a part of the hospital labeled as women's health. Both the nurse and the gynecologist also took the extra effort to ask me what name and pronouns I preferred just to double check. Considering that I was at a clinic dedicated to female reproductive health, this made a huge difference in my level of comfort in that space. At any gynecological appointment, the doctor is going to ask questions about your sexual history, who you have sex with, how many partners you have, whether you use protection, etc. In medical school, we were taught to ask this question in the following way: do you have sex with men, women, or both? That question is affirming to gay, lesbian, and bisexual people, but excludes the possibility that someone might be with a non-binary partner or partners. However, at this clinic, the gynecologist asked, what are the genders of the people that you have sex with? This simple change allows the person to self-describe the genders of their partner or partners without assuming that they are either male or female. The gynecologist also asked the questions in a way that was very open and accepting of people who have multiple sexual partners. While subjects like non-monogamy and multiple partners can often be difficult subjects for doctors to broach, the fact that this doctor made it clear that any arrangement of consenting adult partners was okay made me feel much more comfortable. As I mentioned earlier, I have had an IUD inserted before and found it to be a painful experience. During that experience, I had to stay at the office for about an hour afterwards because I felt lightheaded and felt nauseous for the entire rest of the day. Though I knew that this was the right choice for me, I was not eager to repeat that experience. Further, I had not been offered any kind of anesthetic or pain relief during the previous experience, aside from Advil, which only helps with the cramping afterwards, not the actual insertion. I was under the impression that because the procedure was so short, anesthetics or analgesics were just not used. However, during the pre-appointment counseling session, I asked the nurse if there was anything they could give me to help with the pain. She said she didn't know, but the next day the gynecologist took the time to call me and talk to me about what my options were. She said she could prescribe Xanax for the anxiety, and she could inject lidocaine, which is a local numbing agent, into the cervix in order to lessen the pain. I ended up taking one pill or 0.5 milligrams of Xanax beforehand, as well as getting the lidocaine injection. And I have to say, for anyone getting an IUD inserted who is afraid of the pain, ask for a cervical lidocaine injection. There was some pain during the actual injection, but afterwards I could not feel any of the rest of the procedure. But beyond the actual pain relief, the fact that the doctor even took the time to call me and that she took my pain seriously and suggested ways to address it was just an incredible part of the experience. So I hope that going through all the ways that this experience went right was helpful. I hope that patients, especially trans and non-binary patients, take this as an example of what is possible from the medical community and that you should expect nothing less. And to the medical professionals watching, I hope that you take this as an example of how you can be more affirming to your trans and non-binary patients. And I hope that you implement these practices in your own clinic. And please share this to increase the awareness of what trans-affirming healthcare looks like. Thanks for watching, and I'll see you next week. Bye.